So let's talk to the listener who is saying, you know what, I'm going to prepare myself to go talk to my doctor. I think I'm having all of these symptoms that I'd like to talk to him or her about. How should a patient prepare for that discussion with their doctor?
I think you want to think about what are your, what's the most bothersome symptom to you? And I always ask patients to rate things on a scale of 0 to 10, because I really want to know about the impact on their functioning, the impact on their quality of life. It steers me in the right direction on what's probably going to be most helpful for them. And that's really what I want to think about. So, are you missing, for example, are you missing sleep? How many times are you waking up at night? How many hot flashes do you have? Is this having a real impact on your mood? So if you had to rate your mood out of 0 to 10, 10, you feel amazing. And if you tell me your mood is consistently 3 out of 10 for like the past 3 weeks, that's really significant. It really gives me a sense of what's happening for you. So to have a sense of what your symptoms are and to tell me what your hope is. Like, what is your number one hope? Sometimes people come in and they're like, I just want to understand this. I'm feeling a little bit crazy. Is this real? So sometimes that's it. Sometimes people come in and they're like, actually, I really need time off work. It's not that I'm so worried about the symptoms, but I really think I just need a vacation, or I just need to work part-time for a few weeks. I need to catch up sleep. I need to reprioritize my life. That's fine. Like, I can help with those things if I know what somebody's goal is and what's their number one hope. And the next thing I would say is good medicine requires multiple visits and follow-up. So don't be surprised and don't be disappointed when I say, please come back because I want to have another conversation about it, because that's how I can give really good care.
I felt like I hit on a gold mine when I discovered the tool to find a menopause specialist anywhere in North America. So I want to pause here for a second, because this podcast, I think, will be a game changer for women wherever they're listening, whatever province or territory, because the tool is really simple. You just plug in your province or your city and an entire list of menopause practitioners who have been trained and certified by the North American Menopause Society / Menopause Society pops up. And it even says if they are accepting new patients, and the phone numbers are there and the addresses are there. I have sent so many people that I know that have not been able to find care in any way for years to this site, and they have found their person. So this is really crucial, because you're right. Maybe your doctor's really honest with you and says, I'm not the right person to be caring for this, so we're going to need to go somewhere else, which is wonderful. That's great to acknowledge, but you just don't want to leave. Obviously, no doctor wants to leave a patient without options. I'm sure of that. But this site for me was a game changer, in addition to so much information that's available there. And here's the thing. This is why this podcast exists, Dr. Shaw, because when I discovered this website, the North American Menopause Society has been around forever. And I thought, why have I, very well-educated woman who prides herself on taking care of herself and knowing all the things, never heard of this, never seen this website? So I really hope that this is an opportunity for us to make this website crash, because not because I want it to crash, but because so many women are going to say, oh my gosh, what a discovery. So I'm going to say one last time, the North American Menopause Society, go onto the website, NAMS practitioner, and wherever you are in North America, you can find a practitioner. I'm very passionate about this, as you can see, Dr. Shaw. So I'm so glad you brought up NAMS, because it is so huge.